Welcome to Fierce Fit Feminine and Other F Words, a place where women in business come to learn more about their health, beauty, body language, and communication. I'm Christine Brunelli, chiropractor and former beauty salon owner turned image consultant, helping professional women look and feel fabulous from the inside out. Today, we are talking about the inside out, and we're going to focus on your health, and we're going to focus on those things that you might be postponing that you probably shouldn't be. We all have them, and today we're going to talk about them. Are you ready? Let's dive in. I went to the car wash today, and the check engine light came on my dashboard. That dreaded light, right? And I drive a higher end, a little sports car. When that light comes on, not a good thing, because usually I have to take it to a dealership or find someone that specializes in European sports cars to fix it. Anyway, after a lot of money, it gets fixed. That's my point. And so I have a tendency to let that check engine light go for a little while if I don't feel like spending the money. It's similar to how a lot of people treat their body, especially in the United States. Let's say in January, health insurance deductibles start over again, oftentimes in the beginning of the year. And if you're not familiar with health insurance deductibles, that is how much money you have to spend out of your own pocket before the insurance company will kick in. And in my chiropractic practice, watching this happen years and years and years, people would have back pain and stop coming in when their deductible started over again in January. And then they would wait until they're absolutely on their deathbed. Like, I can't sit up straight. I can't walk. I'm stuck in bed. Help. That's when they come back in. It might be the same thing for dental work. And I know dentists, and they say to me, they wait until the last minute. They wait until it's in a full-blown abscess. And if you're a dentist, you know what I'm talking about. They wait until the last minute. I am not like that with my body. I can be like that with my car, but that's because I know the difference between signs and symptoms in my health, and I'm very dialed in to what signs and symptoms are. So let's just talk about you for a minute and differentiate signs and symptoms. Symptoms are what we feel. So whatever you are feeling, maybe you are itching from a rash. That's a symptom, right? The rash itself, when you can see it visibly, that's a sign. There's a difference. A sign is something that others can see. A symptom is what we experience. If we're at the point of symptom, it's too late. If you are pulled over on the side of the road with steam coming out under the hood of your car, you waited too long when that check engine light. Now, I've never done that, so we're good there. But you waited too long. Now, this episode is being released in March of 2023. March is famous for when people stop working on their New Year's resolutions. Now, a study just came out and an article was released in fall of 2022, and it was funded by a company that makes vitamins, but they studied American habits and how Americans are famous for postponing habits in the fall because of the holidays and Christmas coming up, and they won't kick in their healthy habit until the new year. And then what they found is, and this is true whether it is true for you or not, but it is true in general, by the time March rolls around, you're not sticking to your resolution, your intention, your healthy habit, the same way you had gusto in January. Am I speaking to anyone here? So first, let's just talk about what some of the most common ones are. Most common, of course, is eat healthier. 55% of Americans surveyed in this study say they want to eat healthier, but they postpone it in like the holiday season to start it in January. That 55%, over 75% fall off the wagon by March. So they start off gung-ho, and by March they're done and they're back to their old habits. Exercising more. 54% of people surveyed said, I'm going to exercise more in the new year. Now, I have been a gym rat my entire life. I've been in the fitness world, not just for myself, but I've been in group fitness, teaching classes, personal training, all of the things. That was my first job while I was in high school. I've worked through gyms and all of that through college into now I do it as a hobby for fun. I can tell you without a shadow of a doubt, March, the gym is not as busy. It might be a little bit when it's sunny outside. People are like, oh my gosh, I'm going to be in shorts and t-shirts. And then it just drops off compared to January. So if you're still really going at it in your workouts, good for you. Don't quit. But in January, it's crazy town, right? The gym is packed. There's not a treadmill or elliptical machine to be found. The group classes are full. The personal trainers are booked. Everybody is gung-ho. By March, we see a decline. By May, June, the gym is a ghost town. So if you have made a commitment to exercise more, are you part of that 54%? And have you stopped? The next thing people want to do is focus more on self-care. 49%. This is very high, and I'm really happy to see that number. 49% of people say they want to focus more on self-care, and they start off gung-ho in the beginning of the year, and it drops off again in March. There are other habits that people say they want to do, like improve their work-life balance, maybe save more money, all of these great intentions. But what happens with our health when we don't pursue them, or we start off gung-ho and we drop off? Is it helping us to start off gung-ho and drop off? What's happening to our body? That's what I want to talk to you about, because maybe you're not someone that's super in tune. Maybe you have signs and symptoms that you just ignore and think, it'll go away. Sometimes when you have a recurring sign or symptom that's not going away, recurring means it comes and goes, comes and goes. That is a check engine light that is telling you better get it checked out. So if you started off gung-ho at the beginning of the year, you dropped off your healthy habits now by March, and in all of that time, your reason for getting healthier was because your check engine light was showing, and it kind of subsided, and now it might be showing again. This episode is for you. I'm going to talk about some of the things that require immediate attention, and then some of the things that don't, but will down the road if you ignore it. One of the first things, obviously, out of the gate is chest pain, pressure, anything that has pain in your chest and radiates. You don't ignore that. You just don't. Get it checked. Even if it wasn't a full-on heart attack, it could be a precursor to something in your heart that can be prevented down the road. Ignorance is not bliss in this case. Don't ignore it. Shortness of breath, difficulty breathing. So obesity is definitely something where we see shortness of breath that's continual. A lot of obese people do not have great lung capacity, and that's a normal for them. But if you have a sudden shortness of breath, or something that is just saying, this doesn't feel right, like I'm normally able to take full breaths and you can't, something's up. Don't ignore that. When I say don't ignore it, I don't mean take yourself to the emergency room right away. Maybe, especially if it's combined with chest pain, but just shortness of breath, if it's not a normal for you, is something that you don't want to ignore. Get it checked. That's the check engine light you don't ignore. Headaches. Okay. The number one reason besides low back pain that anyone comes to a chiropractic office is for headaches, because we help headaches. I mean, we call it cervicogenic, which cervical is your spine, right? So cervical headaches are because something in your neck is out of whack. I'm just going to put that in the basic layman terms that I can. And sometimes one adjustment in a chiropractic office will clear the headache, but sometimes it's been something that someone has lived with for quite a while, and it takes a few treatments before the neck finally settles into alignment the way it should and the headaches subside. But if you're having those kind of headaches that, maybe a chiropractic adjustment is helping, that's not normal. Headaches aren't normal. It's something that I have heard so many people say, I've lived with it my whole life. It's just normal for me, but it's not normal. It might be normal for you, but it's not normal to have a headache. So if the headache can't be cleared with things like better diet, less caffeine, less sugar, chiropractic care, massage, maybe acupuncture, all of those things. If those headaches don't subside with treatment, you need to go the next step. And you should be with a provider that suggests that. If a provider is not suggesting that, you need to start questioning that provider. Maybe they just don't understand. So a headache is not normal. My goal as a chiropractor is not to keep you coming back for life for headaches. My goal is to clear the headache, right? Now that's one kind of headache. That's someone that suffers with chronic headaches. But what if you have an unexplained intense headache? The words that I am trained to look for is, this is a weird headache. This is something I've never felt before. This is the worst headache of my life. And I have the diagnostic ability to say, rule out whether it is a migraine, because that will definitely lay people flat out and they'll say it's the worst. But people with migraines as adults usually have experienced them in a previous episode. It's not new. I'm talking about an intense headache that came out of nowhere. And maybe with those headaches, you have some type of confusion, or you might have maybe hand weakness. That's when we're talking about you could have had a mini stroke and not known about it. And now you have this headache that you can't explain. It's something you've never ever felt before. Get it checked. That is the check engine light bleeping, not orange, red and blaring at you. Don't live with it. It's not normal. Okay, we all know allergic reactions that we should not let allergic reactions continue on. That seems to be something that maybe the AMA, American Medical Association, and others have really done a good job educating people on, but you need to really pay attention to those signs and symptoms. If you're allergic to shrimp, but you love them, don't subject yourself. Maybe that next shrimp that you have could put you into anaphylactic shock that you don't want to go through. You're just going to have to turn the corner on that one, walk away. The check engine light there is saying don't do it. Okay, unexplained weight loss is another severe one that I will tell you a lot of women will be celebrating in the beginning, and then after a while they're going to go, something's up. Almost all of us want to shed some weight. Almost every woman I know wants to lose at least 10 pounds. The average is 30. If you're losing weight without trying, maybe you think, I'm cutting back on carbs, or I dropped alcohol and I'm not drinking alcohol, so I'm losing all this weight. If you're losing an abnormal, unusual amount of weight just from that, that's not normal. That's not. Unexplained weight loss. You will lose a little bit if you cut alcohol. I have been dry since I ran the Dry January Challenge. I still haven't had any alcohol. It is March and I feel amazing. I actually had dinner with some friends last night and the red wine was flowing, and one of them was my favorite Cabernet Sauvignons, and I just didn't even feel tempted. It feels so good. I have better sleep, so it feels so good to not have interrupted sleep. And it's the best beauty hack. Honestly, good sleep is the best beauty hack. But even though I have shed a few pounds from abstaining from alcohol, maybe 5, it hasn't been 20 or 25. If it was, that's what I'm talking about with the unexplained weight loss. If you're going through that, that's a red flag. Unusual bleeding. Most people get scared of blood and they don't ignore it. But if you are having, blood in your stool, blood in your urine, blood places where you shouldn't have blood, obviously, check engine light is on. If you have slow healing, wounds that won't heal, that's something, even if you've had it all your life, I don't want you to ignore that anymore. That's something where your body is saying, my friend, you need some extra help here. Something's going on. Your body, unless you were born with a syndrome or condition that is, earmarked for slow healing, your body was born with the ability to heal itself, which is a miracle in itself. It's just something that blows my mind. But if you scrape your arm, you don't have to do anything. If even a little bit of blood is showing, the body knows exactly what to do to heal it. Exactly. Without you putting on Neosporin or a Band-Aid, it still heals and scars over, right? It's such a miracle, which is why I love health. But if it takes really, really long for your body to do that, and you're not suffering or a victim of a syndrome, that's something you should get checked out. Your body is depleted in something, and I wouldn't wait on that one. Leg swelling. If you have not had injury to knees, ankles, any of that stuff, and you have unexplained leg swelling, check engine light is screaming at you. That often is some type of, well, the first thing most people think of is congestive heart failure. Or if you have that with kidney problems, you can have it show up with some type of vein issues, the veins in your legs. You can get that from flying. So if you're in an airplane and I had that happen once. It was this most strange thing because ankles and wrists, they're like my smallest parts on my body, and my ankles ballooned. And I was like, oh my word, doesn't even look like it's me. But they came down. As soon as I came out of the air, it was a transcontinental flight where I was going from the US to Europe, and I just swelled. And when it goes away, you know you're okay. But when it's big and you push your finger in it and the indentation from your finger is still there, that's called pitting edema. Not good. My girl, make an appointment. Go see. I would go right to a heart specialist for something like that. A GP is going to refer you there anyway, but do whatever you need to do to get yourself in to see someone, because that's not normal. Abdominal pain. This one is really interesting because so many people have digestive issues. So they live with chronic abdominal pain, and just like the headache, they think it's normal. Abdominal pain is not normal. So if you have to be close to a restroom after you eat because something's going to happen in your stomach, like I have to be close to a bathroom because I don't know. It's going to come out one or the other ends. It just always does. That's my normal. My girl, that's not normal. Might be your normal, but that's not normal. You may have irritable bowel syndrome. You may have colitis. You may have a bleeding ulcer. Who knows? But those things can all be treated. And something as simple as, and I'm going to call it simple, but irritable bowel, you can do an elimination diet, eliminate the foods that cause it, and you won't need to worry about that abdominal pain anymore. Some people are really willing to go the distance to do the elimination diet. And if you've done it, you know what I mean. Sometimes it's dairy, sometimes it's eggs. There's an allergy that your body is having, and it's causing your stomach to wreak havoc on you and have pain. And give up the eggs or give up the dairy or give up whatever it is, gluten maybe. If you're a celiac, give those up and you won't have that pain anymore. But that pain isn't normal. One of my employees had very bad pain. She would come in and out young, in her 20s. And she's like, oh, this is normal. It's just abdominal. And it's not cramps. It wasn't monthly. It was stomach. And I realized after talking to her for some time, this was connected to her caffeine habit. She loved Red Bulls. She drank coffee. And if you have any type of an ulcer and it begins to bleed, caffeine irritates that. Acids, like anything that has a high acid content, let's think tomatoes, pizza sauce, anything like that, citrus, it irritates it. In order to heal, you have to let those things go. Maybe you can reintroduce it later, but to heal and not have the pain, those things have to go. But you won't know that until you get yourself in to get checked. Okay, these are some other ones that a lot of people, I don't know, if you have a change in mental status or sudden confusion, I'm hoping that that's a check engine light that you would not ignore. But if you're noticing it with other people too, maybe someone in your family where it's just off, it seems like, wow, there's something that just abruptly changed. Don't ignore it. Aging does not have to look like that. There is so much biohacking in the world right now where aging does not have to look like dementia, forgetfulness, any of this stuff. Neurohacking is like hacking, which means you can do your own things to help your brain, right? Neurohacking, biohacking, your own things to keep your body healthy. We don't have to age in the way people have this idea of aging in their mind. It doesn't have to be normal to be forgetful, to be confused, to have poor walking gait, to shuffle. All of those things don't have to happen. They don't. We need to change that we believe that's what elderly life looks like. It does not have to. You can be, I know people, 88 years old in the gym right now, spry as a cat, sharp as a pin with their mind. It doesn't have to look like that. So don't attribute those things to aging. Don't. Get yourself checked. Go somewhere and get checked if this is you or for your loved ones. Severe dizziness, that's a no-brainer. I have had bipositional vertigo, which is like the crystals in my ear canal got all out of whack. This was about 10 years ago or so. One of the worst experiences of my adult life with my health. I knock on wood, I am very healthy. My biggest issues with my health, I don't take any prescription medication, zero. I don't have anything for my vision except something to help me at night, because the shape of your eye at night changes as you age, and something with the shape of the eye and lights. So I help that at night, but I don't need reading glasses. I've been really blessed that way. My biggest issue was my dental work. Oh, that's where all my health money went. But that's another topic, another day. That's all healed too. But that was like where all of my time was spent, was in a dentist chair for my health, because your oral health, if that's no good, that affects your whole body as well. So anyway, the other thing that I've had though was vertigo, and vertigo is not mild. I mean, I didn't have mild vertigo. I had to cup my eyes. Like, think of putting blinders on a racehorse. I would take my hands to the edge of my eyes and just hold the room steady, because it felt like it was going in circles. And it hit me out of my sleep. I woke up on Christmas Eve morning, got out of bed, took one step and fell. Didn't even know I had it. That's a sign something's going on, right? Most people run to the doctor for that, and they should. That's not something you just want to ignore. A chiropractor can help with that, and that doesn't mean that it can help with all vertigo, but my kind of vertigo, chiropractic has, and other physicians that are trained in the Epley's maneuver can help get that back to normal. But that dizziness, not good. Vertigo, awful. If you've ever had it, you know. It makes you feel nauseated. It's amazing how much your vision helps you feel stable. Like the horizon is horizontal right now. Wherever you're looking, the horizon is horizontal. When you have vertigo, it's not. It's like you're in, I don't know, a small fishing boat that's in horrible ocean waters, like ready to flip. And I'm not one that gets ocean sick or seasick, but vertigo, let me just tell you, bad. You don't want to go there. So don't ignore that. Chronic fatigue, that is something that has had so much press. And chronic fatigue, after you've done all of the natural things and all of the biohacking things to not have chronic fatigue, if you're still fatigued, then you need to definitely look at, maybe making a doctor appointment for this. So just being tired is not chronic fatigue. If you're not getting good sleep and you're chronically tired, this is not chronic fatigue. If you eat fast food, grease, drink alcohol, have high sugar, high salt diet, and you're always tired, you do not have chronic fatigue. You have poor dietary habits, because food is fuel and you're not giving it the fuel it needs. So there are other things that you might be doing that are causing the fatigue. But if you've done all of the things, like I eat unprocessed foods, Christine, I am sleeping really well, I'm making sure I'm hydrated, I'm exercising, I'm not sedentary, I'm still chronically tired, that is the real chronic fatigue where you need to go get checked out. That's ongoing. That's something that you don't want to ignore. When you've done all the things, and when I say all the things, I don't mean you did it 1 week. I mean, you've had a pattern of 6 months of good habits where you are just making sure that your body is getting the rest it needs, it's getting the unprocessed food it needs, it's getting the pure water it needs, and the movement it needs, because humans were not created or designed to be sedentary. So if you need to wear a watch to track your steps, do it. Don't be sitting all day and then tell me you're tired. Yes, you're tired. It's because you sat all day. Sitting is not rest. When your body wants to move, it's not restful. Your body wants to move. In your mind, it might not think it does, but your body does. It's designed for that. So chronic fatigue is something that you need to really evaluate yourself and see what changes you can make. And if those changes don't change it, then get it checked out. Obviously, changes in bowel movements are something that most women, I would say, are really good at paying attention to. But different things can show up. Again, colitis comes up, Crohn's disease comes up, different things that, colorectal cancer is like one of the top 2 or 3 cancers in the United States anyway. It's called the silent cancer, where you might not even know you have it, but your stools changed and you weren't paying attention. And that's how it developed. It was just several months and then bam, all of a sudden you're diagnosed with it. So that's where, having things checked out and paying attention to your body really matters. How about facial drooping, tingling, numbness, weakness? Okay. So obviously, first thing a lot of people think of is stroke. Facial drooping, though, can also be a Bell's palsy, which is just something with a nerve that goes causing like the eye and the corner of the mouth to droop down. Chiropractic can help that. It's not curing anything, but it can restore. It helps. But this is where we're talking about possible stroke issues, right? Or neurological issues in the head and neck you don't want to ignore. Women were really good about breast exams, I hope. By this point, you're really good at paying attention to what breast tissue feels like, what your nipples normally look like. These are things that you should be definitely. It's very easy to notice things in this area because, again, breast cancer has had such a huge push and big awareness that now we're more in tune. So we don't ignore that as much as we might ignore fast weight loss or dizziness or swelling, things like that. So these are the major check engine lights. If you're ignoring those, my girl, it is time. Just end this podcast right now and find your provider and call, okay? None of these hit on oral health. I hit on the oral health because even though I'm not a dentist, chiropractors really talk about prevention. Dentists are really good about speaking about prevention. That's why you get your teeth checked twice a year. That's why they tell you to brush and floss and all of these things. But your oral health, I know people who have waited and waited. They've lived with a toothache for a long time, and then that tooth is abscessed or they need a root canal. This is something I would say you should not ignore. I'm hoping that the dentists out there are saying, yes, louder for those in the back. But it makes a difference in your whole body health. Your oral health trickles down into the entire body. It affects your whole system. So we call that systemic in the healthcare field. So whole body is systemic. What can be a molar that's infected or abscessed can turn, and so it has an infection that's maybe just really inside the tooth there. If it goes too long, untreated, you're ignoring it for whatever reason, because we all have a million different reasons we ignore things. It can become a systemic infection if you let it go too long. You don't want that. It can actually eat away at the bone in your jaw. You don't want that. So I have to add, you don't want to ignore your oral health either. Okay, so those are the red engine light, it's flashing red at you going, don't wait. Make an appointment now. Now let's talk about the things that you can do to be a more healthy version of yourself that you can apply today, right now. Because I know, based on the study that I referenced earlier, that a lot of you aren't doing these things because it's March and this is when we drop it. So this is your kick in the butt. Are you ready? Let's start with moving your body. Exercise. Okay, let's not call it exercise. Let's call it movement. Okay? Take the word exercise out of your vernacular if you're allergic to it. You are not designed to be sedentary. If you are a mental health specialist, a therapist, you are sitting all day. I know, because I know some of you. That's what you do. You sit all day, and you're lucky if you have 10 minutes or 15 minutes between appointments to nibble on something. You have a very poor diet during the day, unless you're super dialed in and you're taking care of yourself. So that sitting all day is not good for you. They've actually proven that sedentary, and even though you're working and you're using your brain and you're interacting with patients, that sedentariness is cutting our lifespan down. Maybe you're not that. Maybe you are, someone else that sits at a desk all day. Or maybe you have a retail job and you're on your feet. Maybe you're an online health coach and you're online all day. If you are not designating time for intentional movement, I won't call it exercise, intentional movement, you are not doing yourself a favor. So no, we don't want to do this every day. I get it. But you do get to a point where you crave it once you get the habit and you miss it. And that is not a bad craving to have. Maybe it's just taking walks. I always have all of my private clients start with 10-minute walks a day because almost all of them are trying to lose weight. And the first step is let's just start with walking. Don't go join a gym yet because I can't be there with you. If this is virtual and you're across the globe, I can't force you to go to the gym. So I want to know that you can walk. So do this 10 minutes a day. And by the end of the first week, a lot of them are going 15 minutes. And by the week 2, they go 20 minutes because it's enjoyable. And then if they have to miss a day and they worked all day, they missed maybe their lunch walk, then they realize, oh, I need to walk after work. They like it. So it does come. But if you set an intention in the beginning of the year for more exercise or movement and you're not doing it, get back at it. Your body, it's begging you to. It is. And if you don't live in an area where you can walk outside, maybe you're in a city, maybe you're in the rain or the snow, there is such a thing called YouTube with 10 to 15 minute movement videos, whatever kind of movement you want. I don't care if it's dance, if it's Pilates, yoga, HIIT workouts, whatever, just do it. Okay, let's get back into your food because that's another healthy habit that you can change and improve so that your body's engine lights don't go on. What was the thing that you said you were going to do at the beginning of the year with your diet? Maybe you were going to eat less refined carbohydrates. Refined carbohydrates are the things that are usually eliminated if you get into like a trendy diet, but really those are not trendy to eliminate. A refined carbohydrate is anything that's been processed like a pasta, rices, pastas. Refined is processed, and then they have to re-put in all the nutrients because they sucked it out in the processing, right? So chips, that's a refined carbohydrate, like any type of snack, chip, cracker, those things that you know that contribute to weight gain, but we all love them. Maybe that was your thing. Or maybe it was you just wanted to increase your protein. You weren't going to worry about all the carbs, but you just wanted to have better protein. You were going to eat, maybe you were going to choose more fish, or maybe you were going to try to have some healthier snacks instead of going for a candy bar or some fast hit. You were going to maybe try to have a better snack in that afternoon hunger period. Are you still doing it? Are you eating for the energy you want to feel and the energy you need as a woman in business, a woman in leadership, probably a mom, a sister, a caregiver, whatever? We wear so many hats. Is your diet, are the decisions you're making before you put the fork to the mouth or the hand to the mouth, is it the one that is taking you toward where you want to feel? Not just look. I'm talking about how you want to feel. Or is it a quick, instant hit? Those quick instant hits are the ones that get us by March. We get tired of the meal prepping. We just get fatigued, right? This is your reminder to not get fatigued. This was not your plan to quit. Your plan this year was to go forward in health, right? So choose foods for how you want to feel. You want to look and feel radiant? You better be eating more vegetables. And I'm not talking fried. Or I'm not talking even cooked, raw vegetables, raw fruits. That's going to help your skin glow. Things like that. That's what I'm talking about. Pure water. It always comes up every year. I'm going to drink more water starting in January. And I don't know. It stops for some reason. Did it stop for you? Get that pure water going. Food, water, and movement. Now, the final one that I want to leave you with is your sleep. Because if you're not getting good rest, then my girl, no matter everything that we just talked about, when you're tired, you're going to go for the easy food, the fast food. When you're tired, you're going to skip your workout. When you're tired, you're going to open something that comes in a bottle versus just drinking tap water or pure water for hydration. You have to have good sleep. So are you doing all of the things to set yourself up for successful, restful sleep? I follow the 3 rules: no food 3 hours before bed, no work 2 hours before bed. That's my hard one. And then for a lot of people, this one's really hard: no screen time 1 hour before bed. That sets my body up for a really restful night's sleep. And this year in 2023, what has tremendously improved my sleep is no alcohol. And I don't know how long I'm doing it. I'm not trying to be on a sobriety kick. I know a lot of people that did challenges and they ended up being sober the rest of their life and they said they'll never go back. Right now I feel that way. I don't know if it'll stay. I love going to Italy and the wine flows there. And, I might have a glass of wine when I go back. I'm not sure. But, right now it has changed my sleep. I don't have bags under my eyes. My skin tone is more even. I wake up and I'm not wanting to hit snooze. I jump out of bed, literally. Sleep is the most important thing for all of the rest to fall in line. Is your body tired? That's a check engine light that is giving you a warning. It's maybe not red. It's yellow and it's saying, hello, I need better sleep. Because once you're rested, you have more ability to make better choices for your day. You will want to move your body. You will want to drink more pure water. You will want to eat for more energy. That is everything I wanted to cover today when it comes to your health and your body, because I know if you are feeling good and you're at the peak of your health, you're on a better game as a businesswoman, as a woman in leadership, as a mom, as a friend. You are in the zone. So I hope you take all of this to heart and you do some self-reflection and start making changes, especially these last 4. Start implementing them today and making appointments for anything where that check engine light is screaming bright red at you. All right, my friend, I'll be back next week, same time, same place. Bye for now. I have some openings for private one-on-one coaching for women who want a head-to-toe transformation from the inside out. This is March 2023. Right now, I have limited availability, but I do have openings. If you want to build on these healthy habits, maybe shed some weight, and also dress for your body type, find colors that look good on you. It's just a full-on transformation head to toe. Send me an email, info@christinebrunelli.com, or find me on Instagram. My name is Christine Brunelli there, and you can send me a DM and let's talk, because I don't have these openings very often, but I do have some right now, and I would love to partner with you because I know how amazing you can look and feel in just a matter of a few weeks. Until next time, have a fierce, fit, feminine, and fabulous day.